I'm going to talk about candida esophagitis. First, the definition. Infection with candida. It's a fungal infection and is the most common type of infectious esophagitis. Major predisposing factors include antibiotic use, radiation therapy or chemotherapy, hematologic malignancies, and AIDS. A compromised immune system may be the most important risk factor for the development of infectious esophagitis, and HIV or AIDS and solid organ transplant patients are particularly at risk. Other conditions associated with an increased incidence of candida esophagitis include esophageal stasis, alcoholism, malnutrition, and advanced age. Occasionally, candida esophagitis can occur in otherwise healthy individuals with no underlying esophageal or systemic disease. Here we have the first video.
Candida esophagitis is the topic, and I'll talk about esophagitis in general, and then I'll touch base about candida more specifically. Esophagitis, as you can deduce, is essentially inflammation of the esophagus, and the esophagus, of course, is the tube that connects the mouth to the stomach. And in terms of etiology, the causes of esophagitis vary a lot, but the two most common in terms of licensing exams tend to be candida, which is of course the yeast, and herpes, which is a virus. There are other causes, of course, such as GERD, chronic gastroesophageal reflux disease, chronic nausea and vomiting, and also certain medications such as aspirin can also cause.
Let's continue. Application in medicine. Because candida esophagitis is primarily a mucosal disease, it is often difficult to recognize with a single contrast esophagography. In contrast, double contrast esophagography has a sensitivity of 90% in detecting the condition. On double contrast studies, candida esophagitis initially is manifested by discrete plaque-like lesions in the esophagus. Usually the plaques are oriented longitudinally, appearing on face as linear or irregular filling defects with normal intervening mucosa. The plaques may be localized or diffuse and usually are located in the upper or mid-esophagus. Some patients may have multiple tiny plaques which produce a finely granular or nodular appearance of the mucosa. Diagnosis of infectious esophagitis often hinges on endoscopic visualization and histopathologic analysis. Here's another video.
Hey guys, Dr. Axe here, Dr. Functional Medicine and founder of draxe.com. Today I'm going to share with you the exact diet, treatment, and supplements you need to take to clear candida from your body. And this is what I really consider to be my 6-step candida cure diet protocol. And you're going to see amazing results with this protocol. And let me say this first, what is candida? Candida is the overgrowth of yeast and bad bacteria in your body, and it can cause some major symptoms that you want to get rid of. And so some of the symptoms of candida can include any type of fatigue issue. If you struggle with chronic fatigue or adrenal fatigue, those can
Pros and cons. Glucogenic acanthosis, reflux esophagitis, herpes esophagitis, and superficial spreading carcinoma may produce findings similar to those seen in candida esophagitis. However, patients with glucogenic acanthosis are almost always older individuals who have no esophageal symptoms, and the mucosal nodules of glycogenic acanthosis tend to have a more rounded appearance, whereas the plaques of candidiasis are more linear. Reflux esophagitis may also manifest as a nodular mucosa, but the nodules tend to be more poorly defined than those in candidiasis, and they are always contiguous with the gastroesophageal junction. Another video. Next, Candida esophagitis is usually self-limiting, and most patients have a marked response to treatment with antifungal agents. However, necrotic mucosal debris and fungal mycelia, and the esophagus occasionally form a mesotoma. For example, fungus boll that causes obstruction. In other patients, severe Candida esophagitis may lead to development of strictures, which are typically long, smooth, tapered areas of narrowing. In patients with chronic stasis, such as those with advanced calicia or scleroderma, involving the esophagus, superimposed Candida esophagitis may manifest as tiny nodules, polypoid folds, or a lacy appearance in the esophagus. Other patients with scleroderma or acalicia may have a foamy esophagus with innumerable bubbles ledgering out in the barium column as a result of a yeast form of the infection. Here goes the fourth video. Well, let's continue. Bishop-plated necroid. It's easy. The main ethological agent for this disease is Candida albicans. The Department of Public Health registered 15,277 cases of infections of Candida albicans in 2007 in Ecuador. The final video. Or we're just gonna skip as well. In the conclusion, Candida esophagitis is the result of an infection with Candida albicans, which is a yeast which can be found all around the world, and Ecuador is no exception. It is a very controllable and curable disease. It can be identified with a double contrast esophagography since it has 90% sensitivity. Okay, thank you.